member for Kiwetanong.
Miigwech Speaker, Manigijabaya, good morning. In Sulikout, 3,100 people don't have access to a family doctor. That's more than half of the population. The president of the Ontario Medical Association has compared the competition for doctors in the North to Hunger Games. People across the North have the worst health outcomes and unacceptable access to health care compared to the rest of Ontario. Why is this acceptable to this government?
Reply, the Deputy Premier and Minister of Health.
So, with the greatest of respect, when we expanded the number of medical seats available in the Northern Ontario School of Medicine, why did you vote against it? We are making those investments. Every single medical school in the province of Ontario has new seats because of the investments we have been able to make in this government under the leadership of Premier Ford. When we make investments, you continuously vote against it. You know, the Ontario Medical Association knows full well that we are actively negotiating with them right now whether they want to participate in a public participation suggesting that we are not. It's blatantly false. We are very close to settling an agreement with that first year with the OMA, and the OMA leadership knows that, and they shouldn't be playing political games with this very...
I'm going to remind the member to make her comments through the chair and caution her on her choice of words. Supplementary question.
I met with NOSM there a few weeks ago, and one of the things that they said, announcements are okay, but they need resources to be able to implement that change. Speaker, expectant mothers in the North risk their lives by traveling to bigger centres to give birth and receive proper obstetric care. That's if the weather conditions even allow them to travel. At the same time, Speaker, there are few options for children needing pediatric care. The Trillium reported that the closest pediatric care with ICU beds for children in Kenora is London, Ontario. So expected mothers and children need to be closer to home. So I ask, Speaker, why is this government not providing the ICU beds for children in Northern Ontario?
Members will please take their seats. Minister of Health.
Dear Speaker, you know, 2 years ago, we made a $330 million pediatric care investment. And the hospital at the time, CEO in Ottawa, said, and I quote, "This is the largest historic investment in pediatric care in the province of Ontario ever." So we are making those investments. We are ensuring through, yes, working with the Ontario Medical Association to make sure that OBGYN can continue to be offered and available in all of our communities. But I would again ask the member opposite, stop voting against these investments. You are not serving your communities well when you go back to your ridings and say, we saw a 78% increase and I decided to vote against it. It's not how we should be working when we're dealing with this important file, expanding primary care expansion and ensuring that everyone in Ontario has access to services.
Stop the clock. Stop the clock. So I'm just going to inform the House that if members continue to make their comments directly across the floor, instead of through the chair, I will interrupt you in mid-sentence. Start the clock. Final supplementary.
Speaker, the $300 million that she talked about it for pediatric services has not made it to the North. It's very clear. We see it. But also, Speaker, there's a healthcare crisis in the North. You know, there is a mental health crisis. There is an addiction crisis. There is a suicide crisis. The Sulikout Minnehahan Health Centre had to convert part of their emergency department to safe rooms, but that's not enough. Will the minister commit to funding the inpatient mental health beds in Sulikout that are so desperately needed?
And to reply, the Minister of Health.
You know, under the leadership of Premier Ford, we actually have in Ontario the highest percentage of obstetrics and gynecological specialists than anywhere else in Canada. But we are not stopping there. Ontario's investments have significantly increased the supply of specialty physicians. We've seen that for 2 years in a row, a CARMS matching that ensures that every specialist who is chosen has been able to find a position. The investments that we are making in Kenora, in Sioux Lookout, in Timmins, in Thunder Bay continue to ensure that people are getting access to care closer to home. As we expand the MRIs, as we expand CTs, as we expand, yes, emergency departments in Thunder Bay, as I announced with Minister Holland earlier this week, those are the investments that are going to make a difference in your community and indeed across Ontario.